Hello, welcome back. I'm John Payne, physical therapist,
And I'm Kellie Witten, physical therapist.
and we work at Little Squirts Pediatric Therapy Services. And this is our podcast, Little Squirts Big Questions. And we are on our final episode of exploring the potty puzzle. Um, I think if you haven't talked enough about poo and pee in these episodes, we're probably all done with hearing about it. But
Yeah.
maybe by now,
This is my day to day. This is my life, both work and at home. Let's be really honest.
maybe, if you're not bored by now, but hopefully we'd like to bring this all together at this episode and just talk about globally things that maybe signs of readiness, things that you could be doing to help with toileting with your little one, and if it's going well or not going well, and what to do about it. And so, yeah, just giving a good recap to everything.
hmm
So maybe we start back at the beginning,
Yeah.
you know, kind of talking about our pelvic floor
hmm
and its function, and then let's just dive into maybe like when you're raising a child and you're definitely at that point where you're looking
hmm
at diapers, no diapers, what are
hmm
you meaning?
hmm Yeah. So, as a reminder, the pelvic floor, I kind of consider it like a hammock or a bowl. It sits inside your pelvis. So that's made up by like your hip bones, the bottom of your spine. And as a hammock, it has to be able to move, kind of move up and down. So it supports all of our organs, and then bladder and bowel, or kind of the end of the bowel, sit right on top of it. Um, most of the time when we're going about our day, it should be kind of holding on just a little bit, but it has to have some mobility and react to like the pressure coming down on it.
Yeah.
When we're going to the bathroom, it needs to be able to relax and kind of like lengthen and open to let the pee and the poop come out. So, um, and what that looks like, or I guess gaining control of that, is it's different for every kid, but usually like 2 to 3 years old is a pretty good benchmark. It does depend on like where have they been in their development. So if they've been behind on all of their big motor skills, then we can expect that they might be a little bit behind in their
Yeah.
toilet training as well, because you have to develop that muscle control. It's not
Right.
something that we're born with, right? Like that's why babies use diapers.
Right. How big do diapers get? I mean, do we have like
I mean, we go all the way to adult diapers. I would
so,
say that like it can be hard in the in between the
right.
toddler and like the
Yeah.
adults. Um,
Like financially, you're like, this
yeah,
kid has
that's the
got to
other
get potty
thing.
trained.
Yeah,
Like
yeah,
I can't deal with this
yeah,
anymore. Like
yeah,
this is too much.
yeah, yeah,
It's hard to lift up like, 4 or 5-year-old legs. Those are big legs
yeah,
to be
right.
changing a diaper.
Yeah,
Right.
yeah. I
So
know, makes things a little messier, but
yeah.
so yeah, around 2 to 3 is when typically kids tend to be ready. Sometimes kids are ready at 18 months, and sometimes it's closer to like 4. But
What is
again, it
ready for you?
depends. Yeah. You mean, what does that look like?
Yeah. What is,
Yeah.
when, you know, maybe a parent brings it in, it's like,
Yeah.
okay, I'm at 3,
Yeah.
like it's
Yeah.
not happening.
Yeah.
And you say, well, they're not ready. And they're like, well, what do you mean?
Mhm.
What's,
Mhm.
so what am I
So,
missing?
yeah, so some of it is like there does need to be some interest, and how does the toilet work, or how do I
Yeah.
go pee and poop? There needs to be some good understanding of language and ability to communicate. So this helps them understand, to be able to tell you when they need to go, and also be able, for them to understand like you coaching them through the steps of it. They
Yeah.
need to be able to understand that. And that could be different levels too. Like maybe we need to use visual versus verbal. You can be flexible with how you're using it, but they do need to have some form of communication, or at least to be able to understand
Yeah.
what's happening, and some way to show you that to communicate with you when they need to go. Another good sign can be that they're staying dry for a couple hours at a time when they're in their diaper. Sometimes it's kids who don't like the feeling of a wet or dirty diaper anymore, so they want to be changed right away, or they'll tell you like when they go or
Right.
right after they go.
Hmm.
That can just be a sign that they're feeling those sensations, making that connection. And it's also, can they walk well? Can they get up and sit on the toilet and hold their balance there? Do they have the capability to start managing pulling pants and underwear down, that sort of thing? Can they help with wiping? Wiping can be, maybe that's not a skill that they have right away, but
Right.
do they have the ability to help start
Yeah.
on those things?
Yeah.
Um,
Yeah, for
yeah.
sure. When you start seeing all those developmental pieces coming together,
hmm
and So they're coming to you and they're saying, okay, well, maybe I've seen they can
Yeah.
do all those things,
Yeah.
but then we're still having accidents. And that's frustrating
Yeah.
because maybe they're potty trained during the day, but then nighttime is a
Mhm.
mess, or they go to
Mhm.
school and maybe they're on a family reunion, everything's fine.
Yeah.
Summer's great,
Yeah.
and they go to school and there's a big issue.
Yeah.
So like how do you go about?
Yeah. So number one place I almost always started is there any constipation? What is happening at their bowel? Because that can be oftentimes that can be a thing of like if it's hard to poop or really hurts when I poop, then I don't want to use the toilet
Yeah.
because that's uncomfortable. Um, is it how is their body awareness? How are they getting those signals? So especially if we're looking at like when they're at home with the parents and they're doing great versus when they go to school.
Mhm.
At home, they might be getting more reminders to go. So
Right.
are you reminding them every time they need to go? Or are they able to develop that some of their own autonomy with that sense of I need to go to the bathroom?
Yeah.
Um, some people will be like, "Oh yeah, my kid's potty trained," but if you have to tell them every time, every 2 hours, go to the bathroom, they're not gaining that independent
Yeah.
control and the independent sensation. Um, so that can be a factor as well. Um, and like, how are they interacting with their environment versus their internal signals? Like, are they very distracted and it's hard to listen to those things and stop playing to transition to the toilet? Can we build in some supports to help them be able to transition easier?
Yeah.
Those sorts of things. And then we do look at like, is there a strength component to why can't they go? So
Right.
is it the pelvic floor? A lot of times there's core strength associated with that as well. It all goes together. So if that's weak, that can impact kids' ability to hold their pee and be able to release
Yeah.
when they need it to.
Yeah. So just taking all of these pieces, right? We talked
Uh-huh.
about that puzzle of
Mhm.
um, sensory,
Mhm.
interoception. Do I know I need to
Yeah.
go?
Yeah.
And do I have the tools to go?
Uh-huh.
And do I have the tools to let me up?
Mhm.
And
And again, like being comfortable being on the toilet and like being, undressed to sit on the toilet and it's sometimes even like the sensation of wipes and that sort of thing or
yeah,
toilet paper can be challenging. So all those pieces can be
yeah,
contributing factors
yeah.
to it.
So what do you say to parents that come in that are frustrated?
Yeah. I think the big piece of it to keep in mind is like you as a parent have to be in a good place and have to be ready to work through those struggles because the kid will take their lead from you. So it's like making sure that you're really prepped for that. And it is normal to be frustrated, but sometimes it's like, let's look at if there's something going on that's making this harder for your child.
Yeah,
In some cases, I would say maybe they're not ready. Maybe there's some of these foundational skills they don't have, and we need to work on those first before we can achieve toilet training.
yeah,
Or we have some constipation going on. Let's help support that and help
yeah,
them get softer stools and learn that their stool doesn't hurt. And so they're not fearful of that. They're not withholding. Or do we need to just help set up a better routine and schedule to help support your kiddo
yeah.
in making those steps towards going
Yeah,
to the
I'd say
bathroom?
I'm the guilty one is like saying, "Oh my gosh, again?
Yeah.
Like seriously? Like
Yeah.
why aren't we done with this? Why aren't
Yeah.
we through this? Like we need
Yeah.
to be past this
Yeah.
phase." And
Right.
you know,
And there's ups and downs. Like parents will tell you, "Oh, my kid trained no problem in 3 days, like potty trained in 3 days." I would say usually it's a more ongoing process than that.
yeah,
Like within a couple weeks, you have to be consistent. They should be able to be getting some control, but that doesn't mean they're not going to have accidents.
right,
I think just not necessarily being like don't punish them for an accident, but it is okay to be like, "Oh man, like shoot, you had an accident. Like
yeah.
let's work on getting to the toilet next time." Like
And if communication's there,
yeah,
like why not happen?
yeah,
What
exactly.
happened? Like
Uh-huh.
take me through
Yeah.
your process
And
here.
help
Where did
teach and make it a teaching moment too of like, "Oh, you were playing and you waited too long and look what
Mhm.
happens. So next time we can't wait as long. We have to go
Yeah,
right away
right.
when we feel that."
And the repetition can be real.
Mhm. Yeah.
Sometimes takes that
And
lots of reps.
some kids have regressions too. I would say a pretty typical one is like with a big event in their life. So maybe they have a new sibling or something like that. Those can be things. Again, I go back to the constipation. If we have a really big regression, it's like, oh, is there some constipation that's putting pressure on the bladder? Are they withholding because it's painful to go?
Yeah,
Are they not fully emptying because they're withholding, and then that causes that tight pelvic floor, which isn't allowing it to relax.
yeah.
There's lots of pieces there.
Yeah.
Yeah.
So what would you say to those that are listening that may or may not need to see you? How would they know that they need to see you?
Um, I would say that some signs that you would need to come and see me would be having ongoing struggles with constipation. So maybe we get the pee part down, but constipation, the pooping part, is still really hard. And we're having a lot of pain or straining, withholding. We don't really know how to let that poop out. Even once kids get on the toilet, sometimes it's like they're there, but they don't know how to get it out. We can teach them and help them learn how to do that, even at like 3 years old. Another thing can be that like they have persistent accidents that just keep going, even if you've like taken some breaks, taken some steps back, given them some time and return to it, they just never gain that control. Especially when we're at like 5 years old, for sure, even a little bit earlier than that.
Yeah.
I would say if you've given it like a couple good attempts and things aren't improving, then that'd be a good time. Like, hey, let's just check in and see if there's pieces that we can help support.
Yeah.
Sometimes it's just little things. Sometimes there's more going on and it requires more treatment. And sometimes it's just a little bit of support and tweaks, and we can get things improved.
Yeah.
Much better.
It may
Pretty
just
quickly.
be a visit sometimes. Like
Mm-hmm.
the fear sometimes with therapy is like, oh, what's this gonna be?
Yeah.
Like how long it
Yeah.
takes.
Well, I mean, we plug for early intervention, and especially with this, like if we have kids who are constipated and it goes on for a long time, then a lot of times we'll get to what's called encopresis, which is then we have the stool leakage that's leaking around this hard stool that's hanging out in there. And that takes a lot more time and a lot of retraining to improve from that. When if we could have just tackled that constipation when it first started, really hit it hard then, we could have avoided a lot of that.
Yeah.
Yeah.
And it's hard to know.
Yeah.
You definitely want to intervene, but life's busy, and sometimes getting those interventions in is hard too, right? So, and then the cost factor.
Yeah. Yeah.
How much is it going to cost to come in based on whether your insurance is accepted or cash or whatever.
Yeah.
That can be sometimes a barrier.
Yeah.
To get in.
Yeah. I like to tell families like we want to meet them where they're at too, but just know that there is support out there. You don't have to go through this alone. And I would say that pediatric pelvic floor is definitely not a well-known thing. So if you feel like this is what you need, don't be afraid to advocate for that for your child, and don't feel like you have to wait until they're in kindergarten and still don't have control. You can address it before that.
Yeah, I think it's super important to address it before that.
Mm-hmm.
We always hope kids grow out of things.
Mm-hmm.
But a lot of times they don't grow out of them, they grow with them.
Yep. Yeah.
And they become adults.
Yeah. Yeah. I mean, things don't just magically disappear. Kids who have toileting issues, pelvic floor dysfunction, that carries on. It doesn't go away. It might change a little bit, but it's not going to just go away almost all of the time.
And no one's going to talk to you about it.
Yeah, exactly.
I mean, it's not a question that's on your 16 when you're going in for your visit.
Yeah.
They don't ask you if you're potty trained. So
yeah.
That has
at
happened.
That point, yeah.
So you can shove it under the rug and move on with life. But yeah, it is definitely something you address. This has been fun.
Yeah.
I've enjoyed going through this and talking about all the different puzzle pieces, and hopefully it's helpful for those that listen to this. And if you do want to know more, we're definitely reachable.
Yeah.
And we'd love to help you out where we can. So we do have a bonus episode. We're going to do this, so we didn't plan. We were in touch with a adult pelvic floor specialist, and we just thought that would be really fun to bring her on and just have a conversation about what she's seeing in adults, and to see if maybe some of these things have been lingering since childhood, or what would an adult pelvic floor therapist say to someone, in their younger years, so they maybe don't reach to the type of things that she's saying. Definitely a different population and different issues and different problems, but I think on some level there's probably some commonalities and some things that we could learn from her. So
everybody's got a pelvic floor.
Everyone has a pelvic
Everybody's
floor.
got one.
It's like that book, everyone poops.
Everyone poops. Yeah.
So
it's a good one.
So anyway, look for that, and we will see you.